As we all know, the healthcare system in the United States is broken. We need a single payer Medicare for all model. There's no question about it. We have nurses quitting in droves because for-profit hospitals are intentionally understaffed in order to maximize profits. We have Americans going bankrupt due to medical emergencies. We have elderly individuals who are in retirement going bankrupt as a result of medical emergencies, losing their homes, losing everything they have. This is not a model that works. However, there's a little glimmer of hope. Within this for-profit healthcare model, there happens to be a public program that has worked really well. And if we can expand it, and if we can inch closer and closer to a single payer healthcare system, we could be in good shape. Now, we, by the way, might be short as many as 55,000 primary health doctors in the coming decade. So by 2033, the Association of American Medical Colleges estimates that we will be short 55,000 primary care physicians. And part of the reason why is because primary care physicians have to take out a lot of money in loans in order to get their education. And unlike other specialists, for instance, primary care physicians are not compensated as much. They don't make as much money. So it ends up becoming a deterrent for anyone who might consider being a primary care physician. And then here comes Jonathan Michaels over at Jacobin with a program that's already been implemented that could be expanded and could mitigate what we're experiencing right now with a shortage of primary care doctors. In March of 2021, when he signed the American Rescue Plan, President Biden directed $1 billion to a program called the National Health Service Corps. Unfortunately, not many people know about this, even though it's actually been around since 1972. And I will admit, I didn't know nearly enough about this, but it's a successful program that should be expanded. The NHSC commissions medical, nursing, dental, nurse practitioner, and physician assistant students to practice primary care in designated underserved areas, both in rural and urban. So in return, NHSC recipients receive student loan reimbursement or financial assistance to pay for college. Additionally, members of the NHSC are primed to take a leading role in the Medicare for All movement. So think about it. These are people who are interested in becoming primary care physicians. Because of this government, this publicly funded government program, they're able to get their education without taking out massive loans. And then in return, they serve in underserved areas. So it's really a win-win situation, and it shows what our healthcare model really could be if we moved away from this for-profit broken model to something that actually serves all of us, both the individuals who are interested in being doctors and the individuals who need care. So more than half of all NHSC providers serve in a federally qualified health center where patients are seen regardless of their ability to pay. One study by the Kaiser Family Foundation found that federally funded community health centers serve nearly 26 million children and adults, roughly 1 in 12 Americans, in more than 10,400 urban and rural locations. Nearly half of all patients receive Medicaid. In some areas, these health centers are literally the only place people can go to get the health care that they need. Important healthcare procedures, things like vaccinations, by the way, pap smears for women. Again, this is preventative healthcare. It's also very important for our healthcare system to ensure that people are getting the preventative healthcare they need, so they're not ending up in emergency rooms with highly expensive medical conditions that are more difficult to treat. The program not only helps the patients, as I mentioned, it also helps the doctors. So one of the main reasons American medical students do forego careers in primary care is the exorbitant cost of medical school tuition. NYU Medical School eliminated tuition in 2018 in the hope that more students would opt to work in less lucrative areas of medicine like primary care. The NHSC goes a step further by directly placing providers in the communities where they are needed the most, and it doesn't rely on the charity of rich donors. Oh, I love that. It's funded by the public and for the public. You know where they actually use this model, and it's actually it ended up being very successful? In Cuba. In Cuba, they have more doctors and nurses than they know what to do with. In fact, they have so many qualified healthcare professionals that oftentimes what Cuba does, very different from the United States, instead of using war to make everyone else bend to their will, Cuba uses a diplomatic approach by sending its doctors and nurses to various countries around the world to help out when there's a medical emergency, if there's like some sort of outbreak of some sort of virus. It's really interesting stuff. It's great to see not only that it's worked in a place like Cuba where they're obviously under-resourced, but that we have a little sliver of that program here in the United States, and it actually bodes well for both the healthcare professionals and for underserved communities. Now imagine if we could expand this. In fact, imagine if this was our healthcare system, if there wasn't a profit motive, if people were actually placed in were considered a priority over profits. It's possible. We've seen it succeed in a small way here in the US. Let's expand it to the point where we can finally inch closer to Medicare for all, because I think that's the ultimate goal. If we really want to help people economically, if we want to keep people healthy and alive, that's the only real solution to what continues to be a broken for-profit healthcare model.
Thanks for watching The Young Turks, really appreciate it. Another way to show support is through YouTube memberships. You'll get to interact with us more. There's live chat emojis, badges. You've got emojis of me, Anna, John, JR, so those are super fun. But you also get playback of our exclusive member-only shows and specials right after they air. So all of that, all you gotta do is click that join button right underneath the video. Thank you.